Okay, welcome Schulich students. This is a how-to video for Dentrix. I just want to provide a disclaimer that the information in this video is based on troubleshooting at the clinic and not in-depth knowledge of Dentrix. If you know how to make it better, please let Zach at the clinic in Woodstock know, because I'm sure we all want to see this program succeed and thrive. And any help from anybody is appreciated. Okay, so I'm going to try to do a quick walkthrough of everything you need to know to have a successful first day, and however long your stay at Woodstock is. So when you open the computer, you will have the desktop page, and the launch icons are here on the left. You will be using the Dentrix launcher and the Cydex one. Dentrix is the clinic management software that they have, and Cydex is the X-ray one. For Dentrix, when you click this, it opens this panel, and this is the software and how you navigate through it. For you guys, at the moment, the minimum you need to know is that when you click on this computer, it opens the appointment booker. And when you go into the operatory, you can access charting if you need here, or also appointments here. That's how you navigate around. So I already have the appointment booker open. So I'm just going to open that here with our test account. This is called UWO Training. It is a blank account that we used to demo everything and keep it confidential. So when you open the appointment booker and you have your patient scheduled, you would like to open the charting. You select the one that you want. You hit the tooth. And it's a little slow at times, but it will then launch the charting screen for you. And this is pretty much where you will do almost all of your features and functions. One thing to note is at the top here and beside this blue eye icon, it will tell you which patient profile you're on if you're ever unsure. And I'm going to kind of walk you through the flow of what a new patient exam might look like. So you're on the chart, you bring the patient in, you will hit this button called questionnaires, and it will launch another menu. Again, it's slow. This menu will show you forms that have been completed and not completed. For our tester account, we have completed a medical and dental history intake form, but typically it will say not completed, and then you want to create this for the new patient that's in your chair. You'll click this icon that's got the little star asterisk, and it will open this dialog and ask you to select which questionnaire you want to fill out. You'll hit OK. Once the form is open, it will automatically populate the patient's name, and you can go through and fill out the information of the patient either in real time, or if this has been provided in a paper copy beforehand, you can review it and input the data at the real time. And when you go down to the middle, this section is to be completed in the chair, where you put in the vitals and the ASA classification. At the very end, you have the patient select yes to acknowledge these items, and then you hit submit. So you hit submit. Then it should disappear, and you'll see that form now listed under the completed items. If you need to make an edit, there is an edit response button, but truthfully, even if you hit enter new responses, it will open the same form and it will keep the data from before. So This is meant to guide the appointment and to have a quick and a place where all the information is available quickly for reference, but you will still have to input the information into the patient's chart independently. So ideally, for time's sake, the patient does have this in paper beforehand, and then you can just fill it out with them in real time and review the information. So once you have that form filled out, the next step is to get the consent forms. That is accessed through this little chair icon called Treatment Planner. It takes a while to launch as well. Once the Treatment Planner opens, this is its own kind of window in a window. You will create a new folder, so again, the one with the little yellow star, and you will title it kind of what the appointment is today, so limited exam, extraction, tooth 404. Enter. Okay, now you have this folder. There's currently no files or consent forms associated with this appointment today, which is why we have the red cross out. So make sure this folder is selected. It's blue. I'm good to go. I'm going to hit supporting information. It will show me the file that I am currently working within, which is the limited exam extraction of tooth 404. You go to the bottom and there's this drop-down menu of the different consent forms available at this clinic. So say it was a new patient exam and an extraction, you're probably going to be signing all of them. So you'll click the one you want to sign. This is consent for non-surgical treatment. So say you were doing an extraction and a cleaning. You go through the form with them. There should be either a paper or a laminated copy that you can walk them through in person, and then just have them sign here. In the additional notes section, add what treatments you are completing. So you can see I hereby authorize the students to carry out the following procedures. So this is where you access the additional notes button and you can list out what you're doing. So today's treatment. Great. Okay. And then have the patient sign, and then you select your name down from the drop-down menu, and you sign as well, and hit save. Oh. Okay. Okay, close. We'll go through each of the forms because they have different editing criteria. So for the personal health information collection one, if there's a substitute decision maker, please include that in the additional notes, who it is, and that they are a substitute decision maker. Close. If you are doing the new patient exam, you select this one. And there are no additional notes for this one, but if there's a need for whatever reason, same feature. If you want to have written proof that the post-operative instructions for extraction were explained to the patient, you'll have this one signed. And lastly, informed consent for extractions. It's verbatim a copy of the one we have at Schulich, minus the tooth diagram, which should be available on a printout or a laminate again, so that you can walk the patient through. And that is indicated here in the consent that this has been shown to them diagrammatically. And then please use the additional notes section here to type out the treatment planned with the tooth number and name, the benefits, and the alternative options presented to the patient. Close. Again, obtain both signatures, hit save, and then you're good to go. So then in the future, if you come to the patient file and you want to see what consent forms have been signed, or need to reference something, you would then have the folder that you can go into by, again, hitting supporting information, and you will see all the historical forms signed by double-clicking on them, and you can print them if the patient needs a copy. So once you have finished with the consent forms, you probably want to get started with the dentistry, and that requires the intraoral, extraoral exam, any other exams you want to run, and eventually charting. So charting is probably the biggest difference to our salute system, and the reason is everything operates on procedure codes, including the charting. And so on this panel here, there are all the procedure codes that you might need. In theory, sometimes it might not be there. I think that only happened once. But then, keep track of it somewhere else. So let's say I was charting for this patient that they have caries on their teeth. I'm going to select caries. I'm going to come over, and my mouse is like a little explorer. So I'm going to click which teeth have caries. And I'm going to hit this button with the tooth and the check mark. It's called Post. It will populate the caries code at this menu here. And then I'm going to hit Existing Other. I'm hitting Existing Other because the way Dentrix works is you have 4 categories of codes. The conditions that the patients came into you prior to ever coming to your clinic, treatment that you are planning, and treatment that is complete. To my understanding, once it has been complete, the color goes to blue. And so that's existing but completed at this clinic. So that's what the difference is between the green existing other and the blue existing. Existing other is outside of this practice, and existing is within this practice. So for example, if you forgot to add something to the chart, you can then add it later by just clicking existing. So in this case, my example was that caries on these 4 teeth, and the patient came to me with this condition. I've never seen them before. I'm going to hit Existing Other. It will then prompt me with the tooth number. Okay, what surface is on tooth 1, 2? It was distal lingual. Okay, next. It will prompt the next tooth. Next. Keep going. And let's say it's a class 5. And I would hit this class 5 button in addition to buckle. So you need both for a class 5, and then hit OK. Then it will update the chart. Likewise, if I have missing teeth, I'm going to hit missing tooth. I'm going to hit post. I'm going to hit which teeth are missing. And I'm going to hit existing other. And then it will update the chart. Boom, those teeth are gone. Now let's say it's the end of the appointment and I've completed the new patient exam, permanent dentition. I'm going to hit post, complete. I now want to add the periapicals and the bite wings that took place. You can actually hit multiple codes at once. And I'm going to hit post and complete. Now, if I want to see all these codes and things that have been placed for this content, I'm going to hit progress notes here on the bottom left, and I'm going to have multiple options here that will allow me to filter the codes that are associated with this patient based on what I'm looking for. So if I'm looking for complete treatment, I'm going to go here. And I can see, okay, there's the exam, the x-rays, perfect. If I want to look at existing work, okay, nothing has been done there. Treatment plan, nothing has been treatment planned yet. Oh, what does this patient have? Conditions. Okay, so here's where I can find all of that information. And if I needed to make a change to something, this is where I would do it. So I want to show you a little glitch that's in the system. If you are doing restorative charting and you hit composite, where is it? Composite, permanent, bicuspid. I will show you the error, but I also want to mention if you click one surface and it's actually 3 surfaces, it doesn't matter. When the window prompts you for the surfaces, it will update the code. The glitch comes when you use composite permanent bicuspids and you click the tooth, you hit existing other, and then hit OK. It populates a stainless steel crown for some reason. Don't know why. To fix it, you come into this area that I described where you make sure that the conditions are visible and the existing work button. You find the tooth that has the error code, you double click on it, and then go into this menu for the procedure code and reselect restorative, composite, permanent bicuspid. Again, surfaces, doesn't matter, just hit OK, and then in the surface box, edit whatever it was, OK. And that looks good. I'm going to hit OK. It will give me a warning, and then it will update it and get rid of the stainless steel crown that it glitched to. Okay, so at this point I have charted, I have done my intraoral extraoral exam. The next step is to add the patient's medicals. So beside the questionnaire button earlier where you did the medical and dental history review, there is a health history icon. You will click on this and it will open kind of a quick access view of the medications, medical conditions, and allergies. And you can populate this menu by, again, looking for that yellow star. I like to hit add multiple, it makes it a little easier. And then you can search for what you're looking for. So if my patient has a penicillin allergy, I will add that. If they have hypertension, not sure why that's not there, but this is a great time for me to explain that you can add conditions that are not there. I'm just looking for it. Okay, so it's under high blood pressure. Add, and let's do a medication. So levothyroxine, add. I know this panel of or combination of does not make sense, but I'm just showing you how you can add through the different categories. And then you hit OK. It will then auto-populate them into the box for you. Say the condition, allergy, or medication you're looking for is not in the system. Through this same menu, you hit the settings icon and you go to the category that you're looking for. So let's say medical condition, I want to add, I want to do hypertension, though I won't since that would be redundant. It will then have these options which don't really make sense unless you know more about the system. For now, just deselect the first one, and if you don't think it's critical or deserves a pop-up, then unselect these. If you're unsure, just leave them. Hit OK. So now you'll find it alphabetically listed here, and you'll see it has the same icons based on what you just selected on the checkboxes. And then it's there for you to use. If you want to delete it, again, you come from this menu and you hit delete, and it's good to go. If for whatever reason you added something to medical conditions but it really belonged in allergies, you can move it back and forth between the categories. However, just be cautious not to do it more than once because it creates a glitch where you then have to add it to both sides and then delete the one you don't want. Okay, so that is updating the patient's charting. Now you've completed the appointment and you want to do the appointment records. So just like here, it shows you the patient. Right here, it shows you the provider. So each one of you will have your own independent number. Make sure you know your number so that anything you're charting or making appointment records for is under your name. I want to make a new appointment record, so I'm going to click this records with a yellow star. It will open this dialog and you can then go ahead and write the records. So for example, today, next visit, and then patient arrived, blah, blah, blah. All the other stuff, including the sterilization record. Really cool at the Woodstock Clinic, they have a scanner for the sterilization record. It's really just point and click. The first click is turning on the laser, and then the next click is actually scanning, and it will input exactly all the stuff you used for sterilization, which is awesome and quick. There are pre-built sentences within the system. However, some of them are kind of clunky and awkward looking and not great to use, but if you're familiar with it, this is where you'll find that panel. And by all means, go for it. Okay, so we've talked about doing appointment records. Say you have finished the record. At the bottom, make sure to write operator, who you are, so student name 1, who is assisting, I guess assistant. Okay, and then who is supervising. Dr. so-and-so. And then you'll have the sterilization stuff below. Once you're happy with it, all done, click Sign Clinical Note. It will prompt you to sign it. Again, make sure the correct provider is selected. And sure, we'll hit OK. And then it will lock this chart for editing. So this cannot be edited anymore. If you need to make an amendment, there is an amendment button. Here we go. The second one in. So new addendum, they call it, in the system. So you can type whatever you wanted. Obviously, don't say you forgot to add something, but whatever you need to add to the chart, hit OK. And it will give you a little warning that it cannot be edited. So we're going to say, yep, that's what I want, and it will add that at the bottom of the same note. If you wanted to create a new appointment record, you can hit that here, and it will create under the same date, add the record. If you made a mistake and you want to delete it, just hit delete, making sure you're on the one that you actually want to delete. Okay. We're good for time, so in this same video, I'm going to show you how to do the x-rays. So we're going to minimize. We are going to go to side X's. I think that's how you say it. And once it loads, you can navigate through the patients that exist through this button here, patient. Let's say you want to add a new patient, you'll click add at the bottom. You'll fill in the information. The minimum required is the first and last name and the date of birth. And then you'll hit save. I don't want to do that at the moment for demo purposes because there are already tester accounts, but that's how you would create someone new. So then we'll go and say I want to take an x-ray for this person. I will hit exposure once I'm on the right name. It will, when you're actually in the clinic and the x-ray machines are set up, it will allow you to select the type of machine you want. So that would be either the intraoral sensor or the panoramic machine. You select it. Again, it's not hooked up, so I will just verbally walk you through it. It then opens a panel where it lets you select the layout that you want to use for the x-rays. You select that layout, and then it will say on the right-hand side why you're taking the x-ray. We've been instructed to select caries every time, even if it's not caries. So you click, and then it will open the capture screen. Go get a lead apron from the pan room, and all the machines are in the rooms themselves except for the pan. And you can just point and click, and the image is captured, and it will pop up right away. Once you are done capturing all the images for that series, there's a button on the bottom right. It says finish, I believe. You click finish, and that is effectively like the send of the x-rays. That finalizes it, no longer for editing. Make sure you're happy with it, because it's a little challenging to edit them after the fact. So make sure the layout's good, the rotations are good, and anything else that you need to adjust before hitting finish. That, I believe is everything. Hopefully you guys have a smooth experience as a result of this video, and enjoy your time at Woodstock. It's an awesome, awesome program, an awesome place. Wendy and Trixie, who are the dental assistants there right now, are super kind and helpful, and I think you guys will enjoy your time.